In today's video, I want to show you a quick set of instructions for a modification to an exercise, the frog exercise. And this is called wall frog. Now, I would really prescribe this exercise for people with anterior pelvic tilts. I really like the frog for anterior pelvic tilts, but if you're really not getting the benefit you should out of regular frog, wall frog might be just the exercise for you for those anterior pelvic tilts. The instructions are very simple. All you need is a wall and enough space so that you can spread your arms out to the side here, and you're just going to scoot your butt all the way up to the wall so that it's touching. You're going to put your legs, your feet against the wall with the toes touching, and then we just let the ankles slide down towards the ground using gravity. This is a passive exercise. We are not trying to pull them as far as they go. Wherever gravity lets them fall, that's just where you should let them be. The only exertion really that you should be applying is to keep these toes together. We don't want the feet and the toes spreading apart, so there's just a little bit of extra work in the adductors and some of the other muscles on the inside of the thigh here to keep those together as compared to the regular frog exercise on the floor. Now, if you have trouble getting into this position, you might not be quite ready for it. Sometimes it can be hard to scoot your butt all the way up against the wall there. In that case, check out the cards for a link to my video about the frog exercise. Now, why do I like this exercise more for people with anterior pelvic tilts? Well, as you can see, this is really bringing my pelvis into a more neutral or more possibly even slightly posterior pose, because my back is going to be nearly completely flat along the ground here. In the regular frog exercise, you end up getting that kind of S-curve in the spine, and I even like doing that one if you watch another video with cervical rolls to promote that proper S-curve. But in people with anterior pelvic tilt, you've already got an exaggerated S-curve. So, or people with anterior pelvic tilt, what did I say? I think I said anterior. With anterior pelvic tilt, you're going to already have an exaggerated curve, and this is going to help neutralize that curve and bring the pelvis to a more neutral position, while also strengthening some of these muscles that are probably going to need some strengthening while you're trying to get rid of that anterior tilt. So that's it for the wall frog position.